Good day everyone, I'm Norhana G. Muhammad from 3rd year B Bachelor of Science in Psychology. So my topic for today is all about gender dysphoria. So what is gender dysphoria? There is one overarching diagnosis of gender dysphoria with separate developmentally appropriate criteria sets for children, for adolescents, and adults. Ang gender dysphoria ay mayroon siyang pangkalahatan na pag-aaral na may hiwalay na mga sets of developmentally which is naaangkop sa mga bata, adolescents, at sa adult. The area of sex and gender is highly controversial and has led to a proliferation of terms whose meanings vary over time within and between disciplines. An additional source of confusion is that in English, sex connotes both male or female and sexuality. So, nasabi nga dito is ang sexual and gender is very controversial at naging daan ng paglaganap or kumbaga pag-growth ng gender dysphoria. Isa pa nga dito ay ang paggalito ng sex. Sex daw ay nagpapahiwatig rin ng parehong lalaki, babae at sexual. Gender dysphoria on the other hand is a term that describes a sense of unease a person may feel because of a mismatch between their biological sex or sex assigned at birth and their identity or gender identity. Here are the diagnostic criteria. Okay, so gender dysphoria in children. So to make it short, hindi ko nababasahin ng mga sentence sapagkat akin na itong ipapaliwanag. Okay, so dito sa number 1 is it's like becoming a strong independent women or like women empowerment. Parang pinapakita dito sa opposite gender na kaya mong gawin ang mga bagay na akala nila is sila lang yung nakakagawa. Or ganun din naman sa lalaki is kayang gawin ang mga ginagawa ng babae. Okay, so in number 2, it shows that in boys assigned gender is mas prefer nila mag-cross-dressing. Or kumbaga mas gusto nila magsuot ng pambabaeng damit or paggagaya nila sa pagsuot ng mga dresses. Kasi nga, mas nangingibabaw ang kanilang kagustuhan sa pananamit pang babae. Like jeans, shirt, denims, or polong panlalaki. Well, sa girls assigned gender naman ay mas nangingibabaw ang kagustuhan nila sa pagsuot ng panlalaki. Yung parang iniiwasan nila magsuot ng mga pambabaeng damit sapagkat ang gusto nilang suotin is yung attire ng lalaki. In number 3, it shows that lacking in a toys or activities. Usually kasi 'di ba pag sa babae is alam natin ang gusto nilang toys or laruan is like Barbie or etc. Ganon din naman sa mga males natin. Pero in gender dysphoria, it's opposite. Kasi nga mas prefer nilang laruin ng mga toys pang lalaki. Ganon din naman sa lalaki, mas ginugusto nilang laruin ng mga Barbie or activities that the girls do. In number 4, a strong preference for the playmates or for playmates of the other genders. So here, it describes that the games of a children. For example, if you are a boy, you prefer to play with a girls or opposite to your sex or gender because that is what you prefer. For while the girls, they prefer to play with a boys because they feel they belong to that gender. In number 5, a strong dislike of one's sexual anatomy. Dito naman is yung di mo gusto sa kasarian mo. Like sa sexual anatomy mo, your parents give birth to you as a male. But what you want is typically to be a woman. It's the same with women. They don't want to be a woman through their sexual anatomy. So, here, sexual anatomy is categorized as a male or female. In my point of view, your biological sex is not the same as your gender identity. So, these are the some gender dysphoria in children. The condition of this is associated with significant distress or impairment in social, school, or other important areas of functionings. Here are the gender dysphoria in adolescents and adults. In the number 1, it is refers to the pubescent or in short puberty of the adolescents, meaning to say in their secondary sex, which is for male is the growth of their facial hairs or changing their voices, while in female is breast developments, hips widen and pubic hairs begins to grow, so that it is mismatched to their gender identity in their secondary sex characteristics because they experience their gender identity than their biological sex. Okay, so here in number 2 is mas matindi ang kanilang pagnanay sa kanilang gender identity which is opposite sa kanilang sex or biological sex. Like for example, for males. So, kapag adolescents ka na, 'di ba, mas mahirap nang baguhin ang kinaugalian or kinasanayan nila, which is mas gusto nilang gawin ang mga bagay na pambabae kasi nga they feel that they are really a girl or mas gusto nilang gawin ang mga bagay na kadalasang ginagawa ng mga babae. Ganun din naman for boys or for girls rather, they do things that the boys usually do. Here in the third number, this is the part that they prefer to belong to the other gender, which is their gender identity. When it comes to men's, they prefer to be with women because that is what they want or what they want to be, or they feel that they are belong to that gender. So as for women, they prefer to socialize with men's because they think that they are fit in. In number 4, a strong desire to be treated as the other gender or some alternative gender different from one's assigned gender. At the number 4, it shows that how some people will treat you as in your gender identity. Or like for example, isa mga lalaking gusto nila matreat as a girl or tratuhin sila bilang babae because they want to be in the other gender that not compatible to their biological sex because in their biological sex is abnormal than their gender identity. In number 5, a strong convictions that once has a typical feelings and reactions of the other gender or some alternative gender different from one's assigned gender. At the number 5, it shows what a person believes in their gender. For example, if you are a man, but deep inside you are soft, which means you have stronger sense as a woman than a man. The same goes for a woman. If you are more comfortable as a man, more the masculine sense dominates you over than feminine sense. And also, how do you interact with the other gender because you insist more on yourself that you're a man, but in your biological sex, you are a woman. The diagnostic features. Individuals with gender dysphoria have been marked incongruence between the gender they have been assigned to, usually at birth referred to as a natal gender, and their experience or expressed gender. This discrepancy is the core components of diagnosis. Ang gender dysphoria is yung hindi pagkatugma between their gender or yung kumbaga yung biological sex nila to their gender identity. It is an experience when someone or where someone assigned gender is not compatible with their desired gender. Like for example, is you are born as a female or male, but deep inside may pagkababae ka or pagkalalaki. Or kumbaga bilang lalaki, mas ma-adapt mo or mas na-adapt mo ang mga ginagawa ng mga babae. Because that was your gender identity. Ganun din naman sa mga babae, mas gusto nilang i-adapt ang gawain ng mga masculine or mas nangingibabaw sa kanila ang pagiging masculine. So, dito naman tayo sa associated features supporting diagnosis. When visible signs of puberty develop, natal boys may shave their legs at the first signs of hair growth. They sometimes bind their genitals to make erections less visible. So yun na nga, invisible signs of puberty develop. So sa boys, they tend to shave their legs and as a sign or as the sign of their growth. And sometimes they bind or tuck their genitals or tinatago nila yung mga private part nila para di mahalata. Same with girls, they may bind their breasts and wear a loose shirt to make breasts less visible. Here are the development and course. Because expression of gender dysphoria varies with age, there are separate criteria sets for children versus adolescents and adults. Criteria for children are defined in a more concrete behavioral manner than those for adolescents and adults. While the criteria in adolescents and adults experience gender and somatic sex is a central features of that diagnosis, which means they have a lot of experience from the desired gender from their environment, like their friends, and they also learn or awaken the central self. Example is ginagaya nila yung voice ng desired gender nila or their movements. So yun yung development and course nila. Here is gender dysphoria without a disorder of sex development. For clinic-referred children, onset of cross-gender behavior is usually between age 2 and 4 years. This corresponds to the developmental time period in which most typical developing children begin expressing gendered behavior and interest. So, cross-gender behavior, a habit of assuming the role of the opposite gender by adapting the clothes, hairstyles, and manner speaking. In developing children, in the age of 2 to 4 years old, this is the time where children begin to express the gender behaviors and interests. For some preschool age, they label themselves as a member of the other gender. Here are the risk and prognostic factors. So, temperamental. For individuals with gender dysphoria without a disorder or sex development, atypically gender behavior among individuals. So, with early onset, gender dysphoria develops in early preschool age, and it is possible that a high degree or atypicality makes the development of gender dysphoria and its persistence into adolescence and adulthoods more likely. So, a temperamental, there will be the possibility na ma-change pa ang gender desire niya. Usually, lumalabas lang ito at the preschool age. So, in environmental, among individuals with gender dysphoria without a disorder of sex development, male with gender dysphoria or in both childhood and adolescence more commonly have a older brothers than do males without the condition. So, in additional predisposing factors under the consideration, especially with individuals with late onset gender dysphoria or in adolescence and adulthood, including habitual fetishistic transvestism developing into autoxenophilia. So, here in environmental naman is like for example sa male who had older brothers, yung gender assigned sa kanya is still there without any condition. So, there is a possibility na hindi niya maituloy ang kanyang gender identity kasi nga napalibutan siya ng kanyang mga kapatid na lalaki for males. Just same naman din for females, ganun din naman. Halimbawa ako, I have a gender identity to be a male. But, yun nga, napalibutan ako ng mga kaibigan na babae. So, there is a possibility na maging tunay rin akong babae. Okay, so dito na tayo sa different diagnosis. In number 1 is nonconformity to gender role. Gender dysphoria should be distinguished from simple nonconformity to stereotypical gender role behavior by the strong desire to be of and the other gender than the assigned one, by the exert and pervasiveness of gender variant activities and interest. It means refusing the gender role behavior in their assigned gender, which means mas gusto nila gawin yung role ng opposite sa kanilang gender. Halimbawa, for males, gusto nila mag-makeup Pero instead na mag-basketball or playing games sila, mas ginusto nilang maglagay ng makeup. Number 2 is transvestic disorder. Transvestic disorders occurs in heterosexual or in bisexual. So, adolescents and adults, males, or really in females, for whom cross-dressing behavior generates sexual excitements and causes distresses or impairments without drawing their primary gender into a questions. Usually occurs in heterosexual adults, roles, or bisexual. It is rare in females. Example is lalaki siya pero mas treat niya magsuot ng pambabae na mas nagkakaroon sila ng excitement to wear the clothes of their opposite sex compare sa assigned sex nila or assigned gender nila. Number 3 is body dysmorphic disorders. An individual with body dysmorphic disorders focuses on the alteration or removal of these specific body parts because it is perceived as a abnormal form, not because it represents or a repudiated assigned gender. When an individual's presentation meets a criteria for both gender dysphoria and body dysmorphic disorders, both diagnoses can be given. Dito sa part na ito na yung removal ng kanilang body parts na feeling nila is abnormal or kumbaga di compatible sa kanilang gender desire. So, ang example nito is mga trans, like sa babae, pinapatanggal nila ang kanilang breast kasi feeling nila hindi yung compatible sa kanilang gender desire. Mas prefer nila ang pagiging lalaki. Ganon din sa lalaki, like pagpapatanggal ng kanilang penis because they feel that their biological sex are abnormal than their gender desire. Number 5, schizophrenia and other psychotic disorders. In schizophrenia, they may rarely be delusion of belonging to some other gender. In a brief explanation, they are being delusional to the point na parang feeling nila is belong sila sa desired gender nila or in an opposite gender. So, in the absence of psychotic symptoms, insistence by an individual with gender dysphoria that he or she is of some other gender is not considered as delusion. Schizophrenia and gender dysphoria may co-occur. So, number 6 is other clinical disorder. Some individuals with an emasculinization desire who develops an alternative. So, example is a female who take on the male characteristic that meets the criteria of the gender dysphoria. However, some males seek castration. Example is pinapatanggal nila yung testicle nila. Pero, yung pagiging male nila is andun pa rin. So, the criteria of gender dysphoria are not met. So, the last part of my report is all about comorbidity. So, comorbidity. Clinically referred children with gender dysphoria shows elevated levels of emotional and behavioral problems. So, most commonly anxiety, disruptive, and impulse control, and depressive disorders. So, sa part ng comorbidity is ito na yung sa children with gender dysphoria or ito na yung part na non-acceptance sa kanilang gender desire. So, like for example, you have this religious family. You may feel the fear to show them your desired gender because baka di ka nila i-accept. You feel anxiety or depressed about it.